Cancer and sex is a very funny issue. A lot of people are very, very afraid to kind of broach that issue. I've had many husbands come in and say, you know, I don't want to touch the breast because I don't want her to be reminded of it. I'm afraid I'm going to hurt her. And on the flip side of that is I've had wives who want to pretend nothing's happened and don't want to talk about the hormonal effects of the treatment, the vaginal dryness, the lack of the libido. They don't want to discuss this because they're afraid that will reinforce to their husbands, I'm different, I'm less than, I'm not a woman. And so it's really important that these issues be brought out and talked about in a place where the couple is comfortable. If they're not comfortable talking about that, it's a very, very affronting issue. It's frequently easier for me as a therapist to deal with a couple talking about mortality issues of relapse and metastases than it is to have the couple talk about their intimate life. So they have to, and frequently it takes almost like repeated events having to get closer and closer to the issue of sexual intimacy. It's not a one-session fix.
I found that a lot of physicians and oncologists don't know how to talk to their patients about the vaginal dryness and answer any of those questions. So women walk away, they're out of estrogen, they have no information and they don't know what to do.
And women aren't given enough information, and consequently they feel, since I wasn't told about this, I must be the only person in the world having this, and I shouldn't talk about it. So that's compounded by the lack of communication. One of the most important things that a woman can do is speak clearly to their oncologist about not just the sexual issues, the physiological issues, the emotional issues, the lack of libido, but also about all concerns and how this cancer may have impacted their functioning.